of the Executive Board, July 9th, St. Joseph Hospital.
Shall we stand and say the Lord's Prayer together? Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Amen. Listen to the roll call. Mrs. Garland, Miss Ellen Jones, Miss Ruth Bryce, Elizabeth Dixon, Miss Patsy Atwater, Miss Nancy Sale, Mrs. Margaret Sitchenbaum, Miss Ludy Manette, Sister Mary Canada, Mrs. Edith Honeycutt, Mrs. Virginia Copeland, Mrs. Virginia Hicks, Mrs. Catherine Pope, Mrs. Glenda Robinson, Miss Martha Davis, Mrs. Minnie Clark, Mrs. Maxine Hensley, Mrs. Margaret Armstrong, Mrs. Estelle Hilton, Emery is Miss Frances Fowler. Is she present?
She's Georgia Bates.
Oh, well, who's Emery?
Miss Smith is representing.
Ruth Smith.
See, we didn't know who would be.
And George Baptist, Miss Frances Fowler. And Grady, Miss Bernice Dixon. Grady number 2 is Miss Annie Stanley. And Piedmont, Mamie Bond. And St. Joseph's, Miss Dorothy Nix, I don't believe is a qualified member now. Madam Chairman, I want to call your attention to the bylaws that after a member of the board is absent for 3 meetings without excuse of the board, they're automatically asked to resign or consider this resigning. I'm sure that we have quite a number of people on here that their attention should be called to the board of the bylaws. If we have bylaws, I think it should be kept, and that these people should be notified that either they attend the board meetings or that they be sitting in that resolution. I want to make this motion to this board that the bylaws be checked against the attendance of the executive board, and that the bylaws be adhered to.
I wish we could vote on this. Is there any discussion, further discussion? There really is a good many here.
Well, you don't actually have to vote on that, do you? It's already a bylaw on that, and you do it automatically.
Call their attention to it.
Yes, yes.
That's what I thought the motion she made was that we do call the attention to it. That's what I said.
Paradoxical thing is where if they vote before the meeting, we have quorum.
Yeah.
Is there any further discussion on this motion? All in favor, please say aye. Contrary, no. Karen, I guess you know who these people are, don't you?
I'll have to check on them to see. I know several that have.
We carry in the minutes those present, those absent, so it won't be but just a matter of checking of those who have been absent for 3 meetings, and some of them, I'm sure, have been absent for more than that.
We have some communications for you at this time. Would you like to read those?
American Cancer Society Georgia Division, 2025 Peachtree Road, northeast Atlanta, 9. This was May the 9th, 1963. The amount is $10. We gratefully acknowledge your memorial contribution in memory of Miss Selma Jordan. Notification was sent to to her mother of Miss Selma Jordan at 446 Candler Street, Northeast Atlanta, Georgia. This was sent to the 5th District Georgia State Nurses Association. This thoughtful memorial gift will further the energy of the emergency battle against cancer through the programs of research, public and professional education, and service to needy patients. Signed, C.A. Clayton. Well, that's nice. The family of Miss Selma V. Jordan acknowledge the grateful appreciation, your kind expression of sympathy. No, I didn't even know that she had passed.
Well, you had an all-day meeting that night, and I didn't get home to read the papers till 11, so we could not send flowers. And they had requested contributions to the cancer fund in lieu of flowers for those wishing to do so. And
She's sick very long. You know, she was active in the association for
Very
years and years and years. And I guess she became inactive probably in the early 50s. But during the 40s, all of the 40s and the early 50s, she was very active in 5th District Nurses Association.
Do you have a report, Ms. Dixon?
I don't.
Do you want to give the report of the treasurer? Ms. May and Jean.
Treasury report for May 1963 brought forward.
is that the district? You have it in your
This is
book.
the
Those are
district.
your
This is-
copies.
Treasurer report.
Okay, let me get to this.
I have one. I think you
Brought
brought
forward
another.
May from May, $3,950.05. Receipts, a total of $513.63, making a total of $4,463.68 on deposit. Total disbursements, $1,330.97. Clearing bank was $3,132.71. Checks out was $321.69. Agrees with the bank statement, $3,454.40. Obligations to the federal government for withholding Social Security, $259.20. And to the state of Georgia for withholding tax was $5.79. I move that this report be placed on file. It's a report of the Nurses Professional Registry, May 1963. Income was a total of $1,186.10. Disbursements was a total of $2,754.43. Balance as of May the 31st, 1963 was $12,373.98. Total of RNs paid at the end of May was 18. Total of RNs part-time paid $10. Total PNs paid $11. Total PNs part-time $3. By Mrs. Carlton, the bookkeeper. I move that this report be placed on file.
Don't you have a later one, Miss Hicks, that she brought to you?
June 1963 income $262. Disbursements, a total of $2,212.15. Balance in the bank was $10,821.85. Total PRNs paid, end of June, 5. Total RNs paid, part-time was 4. Total PNs paid June 1963 was 2. Total PNs part-time was 1 by Ms. Carlton, bookkeeper, and I move this report be accepted.
Thank you, Ms. Dixon. Karen, do you have any further report?
Well, I'm just gonna tell you our membership, because Ms. Davis asked me to report that for you. And the membership to date, we've cleared 1,066. We have 4 to be reported and 3 applications for approval. The reference is not back, which would give us a total of 1,073 with 7 associates. And the CESR section, excuse me, has 8. The EACT section 100, administrative 200, 1 associate. General duty 137 with 1. Public health 101 with 1 associate. Occupational health 45, and private duty 479 with 4 associates, making your total of 1,070 members and 3 applicants. We sent out you 1,500 copies of the meter. They gave us some extra ones, and we're still getting requests. In fact, Dr. Martin's friends, some have been calling for it. And the 1,245 directors have been addressed, but we will have the doctors as soon as the secretary comes back to the medical academy, and send them out approximately 800. Ms. Davis also, while I'm talking, asked me to convey the membership report and the general duty, that she needs your help in helping to get her section going.
Thank you, Karen. Ms. Bryce, you have a report?
Yes, I'm listening for now.
Oh, no.
We're going to have Ms. Connie J. Thomas talk with us here at the next meeting, which is 7:30 Thursday. She's going to talk on current inhalation therapy, particularly with reference to the bird respirator. And she will talk about just a little bit about the more common conditions for which it is indicated, and the key and critical nursing points to be observed, some of the reactions the patients may have, and what we do in particular situations. I think it'll be a very, very worthwhile session due to chronic lung disease and mounting
I hope we have a good enough after here.
surely hope so.
May I tell you that at 2:20 Friday, I realized that I had not sent some notices to the hospitals inviting our students and other members. And in my haste to get through and to be sure they were mailed Friday, I misspelled therapist. And I had already gotten ready to put them in the envelopes, had them all stamped and everything ready to go, and it looked terrible. So I had to take them by hand, but they got in the mail by 5 o'clock Friday. I took them on that.
There's one thing on that ad.
It's wrong.
Pardon? Yes,
Anything?
one thing, but it's not, that's misspelling. Ms. Thomas is not from Emory.
Well, isn't she on the staff?
No, ma'am.
Well, I misunderstood you over the telephone, I'm sorry.
She had, and so if any of you hear that, she is employed by Stansford Oxygen.
Oh, she is,
Here in
yeah.
town and works with
Well, you know,
various hospitals.
that goes to prove you ought not take it over the telephone, because I understood it was bad, and it's my error.
She's, well, I don't think it's very gross, consider that it is.
Please apologize to her for me.
She is employed by Stansford, and has done a lot of teaching nursing in service around the city.
We have a recommendation from the bylaws committee, but guess we better wait on this unless wanna get a referendum vote on this.
We'll have to, September.
Deadline for
Voting on bylaws. To delete from the rules of the Nurses Professional Registry, the word Georgia as a qualification of director of nurses Professional Registry. Madam Chairman, I don't believe this is, a recommendation for the Bylaws Committee, but I believe it is a recommendation from the Executive Board, since the Executive Board is solely responsible for the, functions of the registry. The rules are designed by the, chairman, by the Registry Committee on the approval of the Executive Board, and the Fifth District Nurses Association has no approval of the rules of the registry.
It seemed like they would have a rule, something like that.
They
They were printed in your bylaw book
They were
there, under
printed in your
those.
bylaw book, but they were prepared by the Registry Committee and, brought to the Executive Board, and the Executive Board approves all the administrative functions of the registry, and that is set forth in the bylaws.
In your
Right,
minutes,
it
it
says you
refers
have
to
to
the
okay
bylaws.
Some time ago, it was brought up that all the, that the,
Well, it should,
functions would be
because it
carried
has
to the
to do with
private duty, but I believe that was lost in one of the meetings, wasn't it?
That's the purpose of this meeting, is the fact that it was referred according to your minutes to the bylaws committee, and it was left there on your minutes.
Well, if it has
It's
to
been
go
brought up
before-
3 times, before I went in on that occasion. And they wanted to use that in the spring, in February, and they were cited that that was still there, so that's why they wanted to go ahead and clear that the bylaws committee review it, and whatever action was necessary to be sure that once and for all it would be settled.
I don't have the bylaw book, but if you read your bylaws, it will tell you that the, Executive Board is solely responsible for the functions of the registry. The private duty, section can be informed, but the responsibility lies on the board.
No, that's the old one, I have some here.
Well, the thing of it is
Yeah.
the way that this is found is it's not, it's supposed to be democratic, and that isn't democratic.
They brought up some time ago, and it seems to me that it was,
We got it right here.
several years ago, that, they, carried the business of the registry to the private duty group for approval. And I believe that that was lost, and I think that that was, may have been in,
Well, since that has come as a recommendation from the registry committee, and the board tonight, well, I'll, just make it as a recommendation for the board tonight, that's what it is.
What is the meaning of this recommendation? I'm sorry, I read.
Here's your, may I tell you, the motion came up the last, here's one of the times it was referred to in March 10th, 1959, that recommendations be made to the Committee on the Revisions of Rules, that amendment be made to rule concerning Director of Nurses Professional Register be studied, and consideration be given to eliminate Georgia Graduate Registered Nurse, amend to read Graduate Registered Nurse. And, it goes on and tells you about that, about your budget. Anyhow, it was referred to the bylaw committee at that time in '59.
Ruth, to answer your question, that rule was made years ago during times when, didn't want nurses from other states to come in and take jobs.
In other
Was
words,
back when in bad times, so that, the jobs were protected for the nurses in this area. So that it's just the same reason that the registry has many rules that have needed to be changed. Really, I approve of the change, but I don't approve not being democratic.
Here, may I tell you again, and then on July 7th, 1959, that the Committee on Bylaws be referred the action taken by the Registry Committee concerning Rule 7, Paragraph 2, Director of Nurses Professional Register as follows. Delete the word Georgia, insert professional after registered to read Graduate Registered Professional Nurse. This action taken by the Executive Board. So they've gone back and forth over those
When was
several
that
years.
done?
This was 1959,
1959.
July 7th.
And it never
And-
did come before.
And no, it was left for the bylaws committee to review it.
Didn't have to go to the, neither did it
Well,
have to
it
go,
is.
because the, board was certainly in error, because the executive board shall provide for the maintenance of the nursing professional registry and the nursing bureau. At the meeting of the executive board following the annual meeting, the board shall appoint a registrar committee. At the executive board meeting preceding the November meeting of this association, the executive board shall appoint a chief registrar and her assistant or assistants, all of whom shall be active members of this association. Upon recommendation of the register committee, the executive board shall set the salaries of the registrars upon recommendations from the register committee. The executive board shall outline the duties and define the duties of the registrars, adopt policies of the registry operation upon the recommendation of the register committee. Then under the registry rules, register committee membership and appointment, the register committee shall consist of not less than 9 members, active members, as follows: 1 active member, administrative member, 1 general duty member. Now this has been changed.
Well, there's your new one right there,
That
Ms.
has been
Dixon, in that newspaper,
But it
revised.
goes on, the rest of it is the same, except the representation.
management, it
Even
doesn't say
the
the
bylaws.
This is the membership of the, then the members of this committee must be members in good standing.
Well, doesn't it say in your bylaws that the bylaw committee reviews all of the rules and see that they're in order? I think that was the interpretation there, that while they knew this was a rule, that it was printed in your bylaw book, and that was the reason they wanted to be sure that it did clear the proper channel, and, as it had previously been dropped along the way, and every time action came up for it, why it was brought to their attention that nothing had been done about it. Is that the way, Ms. Copeland, you was the meeting, the bylaws committee, is that your?
Rules, of course, could be, the rules of the sections, but the rules of the registry is, certainly the executive board's responsibility.
The committee took this, question to some degree while they were receiving it, but since it was given in the manner that it was, the committee took the action as a committee on the material that was submitted to them.
Well, it was brought up twice within the past 2 years. I have it here too, that it be referred to the bylaws committee. So that's why we wanted to go ahead and carry out, and they gave us a recommendation from them that it be.
Bylaw doesn't have anything to do with the rules, because the rules is, it's not by the registry and approved by the executive board. Take your turn.
It seems like to me if we're gonna change the bylaws, it goes to the bylaws committee.
Bylaws, though, only bylaws. Rules are rules of sections and rules of the, committees. But the executive board is the, is the body who has full, responsibility of the registry.
But maintaining and operating the registry doesn't say anything about the policies.
Same thing. If you're gonna set standards and salaries, you're sure gonna set the operation, because if you don't, if the executive board is holding the purse string, they surely would hold the policies and the working of the registry.
That was the report that I had been going back into when Ella Best came back in way back 1943, I think it was, that she mentioned that we had written into our bylaws so much of the policies and management, rather than actually things that should be included, that we should set up definite policies and eliminate and make the bylaws just as simple as possible.
Well, now, suppose it does come from the registry committee to the board.
already approved it 3 different times.
I know,
Dialogue
I know.
committee.
Do it one more time.
Just once more.
And that was the reason for the letter, that once and for all, let it be clear, that if the bylaws committee had it and dropped it.
Well, when we don't-
Section 11 on this current one list. Section 11 on the back page, under Article 14.
All right. You want yours for the regular, for the, your section, don't you? Wait a minute, let me get yours. Yes.
It's in section 12
Wait a minute.
of Article 14.
I got a copy of it right here.
The committee on bylaws.
Yeah, copy everything we bring in.
Is that what you're asking?
Committee shall review bylaws, the alumni
Mr. Allen,
section, of all sections. The committee shall report its findings to the executive board for approval.
Well, then, the rest of the committee wouldn't be a section.
No, it's not a section. And so, the committee is under the function, under the jurisdiction of the board. And of course, these bylaws should need, be revised, because since your alumni dues are not coming through, since your dues are not coming through alumnus,
Okay. But in the
our
minutes, see, I
bylaws
think-
would not govern
I
this,
think I have
alumnus
put that
anymore.
in. See, I said that to this one.
So this should be removed, and the bylaw committee should be asked to remove it before the annual meeting.
Well, there's one thing for sure, we're going to have manual, and the past presidents are gonna review every order that's been in that office since 1947. If they can let it stand until we get back from New York and have the meeting of that, then the board approve it, then that will automatically be eliminated, if, that's the feeling of the board. Hmm? If you make new rules and you go over your rules and everything else and policies and any changes y'all wanna make on it,
So they, it should come up here.
I don't have it, Mary, I don't have that, I have the, wait a minute.
There are a lot of places.
And if the
Yeah,
section's not
I got it.
functioning for the, then the bylaw committee ought to be asked to review the functions of the sections and see how they're not functioning. It's already on board. Actually,
If y'all don't mind, I think I'll sit down and do The first thing, recommendation I have is, I brought to the board a while back, and it was referred to the private duty section as information. And at the last meeting, we didn't have a quorum, but I gave them a report on this. But due to the lack of funds at the Nurses Professional Registry, dues be raised to $50 a year beginning in 1964. I brought some information along tonight that I gave to the private duty section about the registries over the country. We have one of the 20 best registries in the United States, I understand. And our dues are also the lowest, one of the lowest. Now, in Santa Barbara, California, the dues are $44, and they have an answering service from 5 p.m. in the evening to 8 p.m. And in San Antonio, Texas is $60, and they have a 5-day week with answering service the other 2 days. And in Savannah, Georgia, it's $50. Tampa, Florida, $60. They have an answering service from 10 p.m. to 8 a.m.
Charleston, South Carolina, they pay $60. In Tuscaloosa, Alabama, theirs is $42. Fort Lauderdale, Florida, $55, and they use answering service. In Sarasota, Florida, it's $60. Daytona Beach is $75. In Orlando, it's $70. And in Little Rock, Arkansas, it's $50. Fort Wayne, Indiana, $50. Ann Arbor, Michigan, $50. Austin, Texas, $58. Houston, $59. Atlantic City, $60. They have answering service. In Cincinnati, $50. They use answering service 4 days a week. In White Plains, New York, is $60, and theirs is in the home. In Syracuse, New York, is $57.50. I mean, this is just some example of views over the country. Now, our total RNs, this has been a little while back, was 393 with practicals, 110, but the total amount paid was 517. Now, $50 times 500 is 25,000. And our budget is, for this year, was $25,034. So for us to operate like we have been operating, we're going to have to raise registry dues. It's just all there is to it. The salaries of registrants are around $20,000 a year. And we have to pay them a living wage. We aren't able to get any help up there as it is. So I bring that as a recommendation to the board.
Recommendations that dues, 1964 be raised to $50.
A year.
In
A year beginning in
Well,
1964.
Mary,
For year
if the Georgia Baptist nurses, leave the registry, how will the registry function even with $50?
I don't think the Georgia Baptist nurses are going to leave the registry.
Had there been any more thought about not having a night registrar?
We have seriously considered and are going to try to get some clerical help up there at night. We do not want to close the registry down at night because we feel that when the hospitals begin calling the nurses, that it will cut down on the girls that work at the registry. And we just feel like to give better service, it's just better to keep it open 24 hours a day. I understand it's a lot of book work up there at night, a lot of filing, and not too many calls. The calls should be filled before the next morning if they're put in that, the night before. They should be filled.
Well, couldn't people begin to think differently though, Mary? They do in other places. And people who are on call, the hospitals could be called and it could certainly know who would be on call. And that would be a whole salary saved. We kept a record at one time about the number of calls received at night, and it's very small. Even if the morning registrar came at 6, one $300 saved, then the clerical help could be there in the daytime.
Well,
But this person that's employed from 11 to 7, when the calls are not many, and as I remember it, they transfer from the daily sheet to these ledgers that are kept, and it's a matter of transferring. Could this person who keeps those books as I remember um, financial records up there that I kept, and I don't believe there would be any more now because you still have the same number of employees as you had when I kept the records, and you have the same amount of tax returns to make as I had. Could this person from 11 to 7 assume this financial reports if she's qualified to do that type of work? Wouldn't you save money there rather with one salary rather than having two there as it is now?
You mean have a bookkeeper?
I don't really
Rather
think that
than
it
having a
really has a
bookkeeper.
bookkeeper because the records that are kept is very simple financial records. And a person who once gets the system in the mind and the the tax returns, it really isn't a matter of having an experienced bookkeeper for it, because I certainly wasn't, and I kept it up there for years and years. And I was just wondering if it wouldn't help, really, to cut down on your financial.
Well, that's certainly a thought,
You know, Mary, I wondered too, I realized that for a long time, some nurses who have been employed as assistant registrars are actually workers have been people who perhaps had health or other reasons why they were not able to do active nursing. I'm not saying that all of them fit in this category, I do know that many of them have, or several of them have. Now, I wonder here, and I don't mean to be callous at all, but I wonder if we shouldn't think about it. If a non-nurse is capable of doing this, then are we justified in a sense, perhaps penalizing a private duty nurse who is working in a patient capacity? Are we penalizing her a little bit in order to give employment to a nurse when someone else might adequately do the job who would not command this wage? I'm not saying anyhow to throw this for consideration. We know, of course, that many registries do operate with non-nurse personnel, and except for the one who chief registrar roughly is a nurse by regulation.
Well, I don't believe you could get anybody much cheaper than the girls who work up there.
Well, now, they make $3.10, beginning. And you see, now that's, now that was one that was rotating the shifts in the night. And now, I don't know,
That's a 5-day week, isn't it?
yes, I just don't know, anything about employment.
Well, I tell you, I have surely been through a siege of this employing of the state office. The employees are the hardest thing in the world to try to
I've
please
had,
the state.
I've had several people tell me that, it being at night that way, we've been trying to fill the night position up there, and, they say, well, if it just wasn't at night, and I've talked to several people that weren't nurses, and I've, really thought that, the next day or two, we called the Georgia Unemployment Agency, and because we just have to have some help up there,
Well, I hope you get better help from them than I got
When you
last year. I
have-
wrote them a letter and called them too, and asked for professional services, and I never did even get a courtesy call from them. And I placed a call with them.
People say that the older people who have to work are much more dependable than younger people that you can get.
well, like the ward clerks at the hospitals, the older ones are just they're just lovely.
Well, I think it would be no problem if we didn't have a very definite age limit on this. We could have particularly someone after 65, another age of 70. I don't believe this would be a
recommended
There's
we
so much
call
to it.
them.
The unemployment.
Mm.
I didn't get a thing out of them last year. I didn't call.
Well, let's go back to the
Motion.
recommendation.
There was no, opinion from the private network, was there? Yeah. About that.
Not too much. The people that were there are usually the ones that were on the registry committee, you know.
What is the alternative? Admin service for part-time?
Well, I just don't know. I just really don't know what would be the alternative.
Well, I'd like to see the registry closed down at night. Have an answer, I don't think you need an maybe you do need an answering service for certain portions of the time. But
Michigan
Hmm.
operates with an answering service.
Well, now, I'll tell you what.
And, some of these registries are right now.
That's when you're gonna get them to pull out from the registry and have their own in their hospitals, 'cause when they're making rounds early in the mornings and they need these people for, emergencies that come in the night.
Well, Carolyn, that doesn't happen very often. If you keep a record, you'll see that it doesn't.
I just-
Copeland, what about the time? You should know about when you call nurses on you.
It's been a long time since I've been doing nights with any consistency, but the ones that you get in at nights are the ones that are so critically
And need them so bad.
These are the ones that will need nurses.
It is the feeling of a registry committee that the registry stay open at night.
As an ex-night supervisor for a brief period, I want to have listed it, because I know in the American, it isn't great, yes, I would agree with that, but
The registry committee, and I have to speak for them, I mean, you know it, I just,
You really need to know
At night, it's
Well, you need to have
4
them.
a.m. or 5 a.m. sometimes, I think it's still all night.
Maybe 7 o'clock before you can.
but now, about our finances up there. We're spending over $2,000 a month. This is 2,221. And we have $10,821 in the bank. And this was for June. Now, you see, we're going to be short some money. And we're just going to have some money to operate that registry like it should be operated. And I can't understand anybody not wanting to pay $50 when they could pay $35.
Did you send your statements out in October? Get a response? We sent ours out in November and we were amazed that we had 185 even
I
before
just-
Christmas. Before we were almost ready to start.
Motion been seconded.
No,
I second the motion.
Would you read the motion again,
due to the lack of funds, that the nurses' professional registry dues be raised to $50 a year beginning in 1964.
And, you've made the motion.
Yes,
Honey,
ma'am.
seconded the motion. Is there any further discussion? Are you ready to vote? All in favor, please say aye. Aye. Contrary, no. And the motion is carried.
Madam Chairman?
Yes, miss?
Don't believe we can take official action on this. I think we're gonna have to ask that a referendum vote go out to the vote.
Well, that's understood on all of this business tonight, because we
I
don't
got
have
to write
the time
minutes.
for it.
And I don't want to get myself confused on approval and carried.
Well, everybody here voted
And,
on it.
Yeah, you don't
everybody
have to
here
send
approved.
them.
Make sure you get
Um,
everybody's name
The
down.
vote to these.
I'm gonna put here on this and then, referendum vote. Be had.
Where consensus is
second, recommendation is, Ms. Minette has, not attended the last 4 registry committee meetings. And it was, recommended by the registry committee that Ms. Clara Burkhalter replace Ms. Minette as Crawford Long representative on the registry committee. The rules, you know, like in this,
I second the motion.
Would you like us to vote, Ms. Dixon?
Yes.
For these grants.
Is there any
That's what we can do.
discussion? Yes, we could, has there been any extenuating circumstance for the absence? Any illness or?
the first meeting, she said that, she was out of town with her mother. Now, the last 3, I haven't heard
How
from.
many meetings?
She
has
said she didn't get one notice, but all were sent the same notices. You know, we have your address graph plates. So if the rest of them got
And
the
Ms.
notices, they
Atkins
were
sent them
mailed.
out for me.
Yes. She told me she didn't get a notice.
Well, I didn't say
Oh, you
it,
didn't say it.
but I was just giving the reason, you know. Because, you know, we have, business to transact about that registry. And we just have to have a quorum. That's all it is to it. We just
It's
have
just
to
like
have a
hiring.
quorum, you know, because people's salaries and people working and, the policies and everything, it's just, the people that are supposed to be there should be there.
Actually though, wouldn't it be better to say a formal notice to go to her that she has missed so many meetings and will be replaced? You know, I mean, there should be some sort of a communication that should go to her. I would think, just courtesy.
Well, that's right, you know, what she wants to, well,
Who will communicate it?
Ms. Dixon.
You want to put that in motion for approval? That'll be written to Mrs. Minette.
All right, I make it a motion.
I wish there was a way I could have this spelled on the minute.
Yeah.
What is
Yes, I think so
Because
too.
it should be just done out of courtesy.
Couldn't we just leave this out and that, just as a courtesy, that'll be written?
How is it done ordinarily when they're asked to come off the board or resign from the board or something? I mean, what is the procedure there?
Have we ever done it?
Years and years ago, we had a member, and that was way back when, that's been a long time ago. When Miss Rakestraw was, and the board was very, very strict about all of this, they followed the bylaw to the letter. There was a member, and they wrote that member, and, told her that she had been absent for 3 meetings with no, approval from the president. And that, asked if her preference was to resign or would she, attend the meetings. And I believe that that member resigned and soon left the city. It's in the minutes of the 5th district. And that was way back in the early 49, so 47, 48, way back there. And we've let these things rock along for years and years that nothing's been done about it.
Well, doesn't this bylaw still say shall be considered as having resigned and automatically?
That's right.
And just call our attention to the bylaws, and we regret that she's been unable to attend the last 4 meetings?
Regret that she didn't resign. Well, we have a vice president that was elected last September, and she's been promoted.
That's true.
That's big help.
Be considered as having resigned the membership on said board, and such vacancy shall be billed as herein otherwise
That's right,
provided.
and it really, I mean, if we've got bylaws, we ought to live with them. No use making them and then
Ma'am.
disregarding them.
Is the registry, rule identical?
They're not interested.
Read over there where it says registry committee, it's in there,
So we decided not to vote on this one,
Just take proper action.
what are we gonna do about this road call?
well, I really think that you could just done what you did without any motions or anything,
Yeah.
you covered.
Well, I mean, actually, there's a motion up there, and mine was just as a point of formality. And I mean, if this committee is the, law behind registry committee, we have to act on the appointment of the replacement.
Yeah.
So I mean, the motion is in order.
You want a letter then to be, written to Mrs. Manette stating
I think that.
stating the bylaw, the action of the bylaw.
Are you ready to vote on the replacement? All in favor, please say aye. Aye. Contrary, no. Motion is carried. Thank you.
Yes. Now, that Ms. Helen White be appointed to fill the unexpired term of Ms. Louise Bone as Chief Registrar, with pay retroactive to July the 1st, 1963.
Mayor, I hate to see this be on the opposite side of the fence, but I have to speak. I feel that it's really, unfair to Ms. White to allow her to accept that position. Because she is emotionally unstable, she is too unstable for the job.
Well, now, she has, let me see those recommendations, please, ma'am. I mean, those.
You mean, which one, you mean all these motions now?
No, the letter from Ms. White.
Oh, the ones you gave me in here. Oh, you mean her references? I think I have mine.
She had, I understand, had some, emotional trouble several years ago. And we wrote for references. We have one from Dr. Merrill, we have one from the Cathedral of St. Philip, one from Judge Crispy, and one from one of the private duty nurses,
What private duty nurse?
Ms. Norwood. Says, and this is from Dr. Merrill, says, "Dear Mrs. Hicks, I have known Ms. Helen White for 8 years and believe her to be an intelligent nurse. I believe that she would be thoroughly capable of handling the job of Chief Registrar for the Nurses Professional Registry. Her health is good, although she occasionally gets worried about herself. She is very pleasant and friendly. Sincerely yours, Arthur J. Merrill."
Have you worked with her?
I have worked on the floor with her.
Well, I don't speak for hearsay.
I wonder what would happen if she's been employed already since the first.
She has been up at the registry now since the 1st.
I wonder what would happen with, a month's, more, would this safeguard?
Well, they are reappointed anyhow in November, so you've got a safeguard there, haven't you, Ms. Dixon, that the registrars are always appointed in November?
Well, she really just goes to pieces over nothing. She doesn't have a lot of stability. And I'm thinking
to 3 is a nightmare.
Have you had any more applicants, Miss?
Yes,
Kidd?
we've had some more. But the registry committee, which Ms. Garland was at, you know,
Wait a minute, what high school is she at?
she's from, Augusta.
She's a sweet person, she's a lovely person, but she just, I really almost cried when I heard she'd been appointed, because I think if a person has regrouped enough to be able to function, I think it's awful to sit by and allow them to get into a situation where they may, fall under again. And, a lot of registrars have cried some bitter tears about that registry.
Well, couldn't you keep her up there and defer your action on it and give her a little more time to see? I shouldn't be talking, but I'm just
Well,
wondering
I
what
just
your
hate-
solution would be there.
You see Miss Glennie went up there, you know.
Did she go?
And Miss Fitz went up there, I mean, you know, to sort of see. And they just didn't like it, and they didn't work out, didn't want it. So, we just thought the best thing to do would be just let Miss White go up there and familiarize herself with it and, find out about it, and that's what we did.
Mary, don't you think it would really be a safeguard for the registry committee if you didn't have an official appointment of Ms. White until you do give her a thorough trial? And then, in the fall, November, when the new committees and the appointments made, then you'd have a better idea, because you'd certainly have time enough then to be orientated and, know what her capabilities are. I mean, then the
She might
board,
function as a
the
registrar, but not.
registry, it would take a lot of responsibility off the registry, and it'd take a lot of feeling off that, well, they can't get anybody up there to hold this job. And if she was up there just temporarily as a trial, that, you wouldn't have this thing of approving and then they leave, which gives a bad, I think, a bad, reputation for the association and for the committee and the registry. And I believe if I were in Ms. White's place, I'd much rather be taken on to see if I could qualify for the place,
I think
rather
you
than
would
put me
too.
on and then come in and say, well, Ms. Dixon, you just don't qualify for the place.
You know, I don't think we can do this.
I don't think we can
In
either.
terms of these very bylaws, it says here,
You mean you can't temporarily appoint?
it doesn't say well, it doesn't say that, I think we can, that was the thing I was asking, let's see the tenure, length of time appointment. But I believe that we will have to, upon the recommendation of the registry committee, give tentative approval or something, or for, definite length of time.
Well, this is just for to fill the unexpired term. Well, of course, you know, they're reappointed ever so often.
November,
At the annual meeting.
following, the first meeting after the annual meeting, which is
But I
November.
really feel like if, I mean, she wasn't approved this thing at this meeting tonight, I mean, she knew this meeting was coming up tonight and all, well, she wouldn't stay up there.
Who seconded this?
I don't think it's had a second.
Now, couldn't you state definitely in your letter there that the appointment expires in November, that registrars are appointed at that time?
Say all registrars are reappointed at the board meeting.
I call a question then.
Well, it's been moved and seconded that this recommendation be approved. All in favor, please say aye. Contrary, no.
Yeah.
In favor, you're out, no.
I could never approve that.
Well, I believe this, really does the same thing, this approval, as a temporary appointment. Does the same thing
The
as
thing
an
about it,
expired
she
term
just
for
hadn't been
November.
up there, you know,
I believe believe it does the same thing.
It wouldn't put me in an embarrassing situation, frankly. 'Cause I just don't know what I could tell her. I mean, I just, wouldn't be anything I could tell her. Now, since this didn't go to the bylaws committee about the word Georgia, I'll bring it to y'all tonight.
What's the feeling of this thing, Georgia,
It
anyway?
did go to the bylaws committee, and they did discuss it and had
Just
them-
like this chief registrar job.
and they
Minister, you
had,
know.
approved it, and so I copied the recommendation for Miss Langford, asking she want me to do the signature on it, and, they did discuss it. Miss Copeland was at the meeting, it was the night we had that hospital meeting.
It just cuts down so on the potential until it's just a
In the bylaws, I've been reading and.
I'll show you. Look in the
It's
professional registry.
Oh, it's.
Uh-huh, back in the back. It cuts down so.
I don't see any point in squabbling about that thing. We've got as many, individual nurses as we've got registered nurses on there.
We'll vote.
Well, the only part of it is, I mean, probably there should be some changes.
Well, you see, then when somebody qualifies that are not from Georgia, then they say,
Still registry rules, so the bylaw wouldn't have anything to do with it. That's board business.
Well, let's vote.
yeah, to delete from the rules of the Nurses Professional Registry, the word Georgia as a qualification of Director of the Nurses Professional Registry.
I second the motion.
Is there any further discussion, Mr. Second Bond?
Yes, the question goes back to this. We talk about chief registrar and this for whatnot. Is this the one and same person, which I assume is?
Yes.
Oh,
Director.
no. Oh, yes,
Yes,
oh, yes.
yes,
uh-huh.
got to
So
be a-
shouldn't this, while we're changing it, shouldn't we get the name right in both places? Or shouldn't we?
Well,
Well, this is not the name, this is taking the, Georgia graduate, from the,
This I realize.
The
but
chief
while we're
registrar
changing
and
this,
director.
why not change the other at the same time?
change for what was the other? What was the other one?
Well, you just use them, interchangeably,
Call them the same thing.
It's the same thing, it's the same thing.
Chief registrar.
Chief registrar.
That's right.
Oh, I see what you mean.
So
The
the-
director of the
Oh,
Nurses
director of
Professional
the-
Registry.
I think that's
And
the
chief
latest on
registrar.
A and E
Oh,
is
the
Director of
same.
Registry.
I see what you
Yeah.
mean.
Yeah.
Mm-hmm.
Now I see.
I copied
While
that
you're
from the
changing Georgia,
bylaws
let's change both.
That's right.
thing.
Are you ready to vote? All in favor, please say aye.
Aye.
Contrary, no. Thank you. Motion is carried. Now, Mayor, what else?
That's all.
Really?
Thank you, Mayor.
We have four. Oh, dear. Well, we only have one section chairman here. Ms. Clark, we've been missing you. You have a report for us?
Well, I did, I was out a couple of times because I didn't think anybody that said my report.
Have a recommendation?
I do not have a report this time because we were able to get enough nurses together to have a forum, so, but we had a very interesting tour of the CDC building and, the brief us on their functions and so forth in the latter part of May, I believe about the 28th, something like that. I had a boy graduating at the same time, I had so many, two boys, rather, so many things going, I hardly knew what I was doing. But we had a good attendance in that, and everybody enjoyed it thoroughly, so we thought that would be sufficient since we couldn't get enough of them together to have a meeting in June, so we do have a meeting planned for August.
Right. Thank you. Alumni reports, I believe Ms. Stanley, you have a report from your alumni.
I just want to make a correction, this, Alma Wood, Alma
administrator. Well, he made more than that, you should have seen it when I got through with it. I had to run 1,640 through that to change the time on that, on the mimeograph machine.
I'd like to move that a telegram be sent to Mrs. Ambrose. One of our members who was injured in an automobile accident over the weekend and lost her husband. If you noticed that last night, 15, they had it missed her in the paper last night. You sound like it's grown.
Where?
But she's in the hospital and I don't know how.
Greenville, South Carolina.
Is she one of our nurses?
She's one of our members. She's public health nurse. We sent a telegram yesterday from GSNA.
Well, has she been, admitted to the hospital? or
She's
was she
in a
admitted
hospital
to
in
the one?
Greensboro.
She's so ill that she can't come down for her son's funeral.
My old boy had heard today that she had passed away, and we got the paper down before I left to see, but, I mean, she just lives in my neighborhood, though, it's not there, my big boy needs the children, but I didn't know it was her.
Don't we do those automatically when we know about it anyhow?
Yes.
If you'll give me the address, I'd be glad to do it.
Greenville General Hospital, Greenville, South Carolina.
And room 606, I believe it is.
Miss Sarah Ambrose.
And she was overseas before she came back, wasn't she? Greenville General Hospital? No, I believe if all of you'd help me keep posted on that, we would notify everybody with cards. I didn't know about Selma Jordan until 2 days before she died, and I had definitely planned to send her a card. And it was just 2 days. I was so surprised in reading that. But we definitely try to keep up with you, but we hope you'll help us in that respect. While I'm talking, before I forget it, Ms. Honeycutt, you remember you made a motion last year that biographical sketches would appear in the meter? We hope we will have those. We hope to have little pictures. And the motion was that we have all reports. I'm telling you right now, just as soon as I can, I'm gonna send you that one little form. So everybody, give me a resume, so we will have those and won't be held up on the annual meeting. So I'll have by August 15th, that's what I want you to know, that, all the reports.
Ms. Smith, do you have a report from your own?
No.
No recommendation? Do we have any old business anyone wants to bring up?
Now, before you adjourn, what do you want me to do on this referendum thing? Just take Ms. Dixon's minutes on that and tell them that, the members voted thusly? Do you approve on
Same
each,
to the
on
members
each,
that are
on
not
each motion
present.
on there?
Some of the members present, and then we had only one dissenting vote on one motion. And just say the number.
You have all those, damn good, all right.
We, have been notified that Mrs. Mildred Price has moved out of the district and belongs to the Gainesville district. But since new committees will be appointed, in September, I don't believe there's any need to replace her on the professional practice committee at this time, unless someone particular feels a burden to do so. Is there any new business you want to bring up?
Oh, I got something I want to ask you. I'm gonna have to have a referendum on this. I move that the executive board recommend to the district that Mr. and Mrs. Hamilton be, that a recommendation be sent to the Georgia State Nurses Association Executive Board that Mr. and Ms. Hamilton be given honorary membership in the Georgia State Nurses Association.
What did we give them?
That was
The
in the
fifth
fifth district. This would be on the state level.
He's certainly done a lot for nurses.
Is there a Thank you for coming, sorry we didn't have a forum.
Miss Stanley, you wanna bring Miss Brown down to the office when I come back? Don't think it'd be nice if I wrote her a note here when I got back. We're gonna let you feel well and know what we do for her.
I don't remember when we've ever had a forum in July.
Hey, Miss Stanley. Hello, how you? Well, I came back from my vacation.
Found all that mail there.
I found 2 stacks of cards for meetings on July 3rd.
You don't mean
I'm on the 29th, you know, I told y'all the board
Yeah, well,
meeting.
that's the day I
Remember all that
left.
rain? Remember all that rain we had here, you know, that we were gonna.
Well, we
but I
left
had
the
to have
28th,
my
I believe it
seven-
was.
I had to have my nominations in, cause I had to go.
No, I didn't even, no, I didn't even, I had some, I tell you, I had a little boy graduating from grammar school, and you have to go to them things just as much as you do a big one. And then I had a big one graduating from high school, and then I had all this to do to get him in tech, right in June now. He started, well, he only had 2 weeks, well, not quite 2 weeks, about 10 days, 11 days, and get him to Florida and get him back and us go in between times so that we wouldn't do